Hello, let's discuss anatomy of ear. Ear has three main parts: outer part, external ear, this middle part is middle ear, and the innermost part is inner ear. First, we will discuss the outer part, which contain the most external part, the auricle. This is auricle. Then this tube, which is called external acoustic meatus, and this part, the terminal part, is tympanic membrane, which separates the external ear from the middle ear. So the external ear, the auricle, has is formed by skin and cartilage, which is elastic cartilage. So this is auricle. Auricle, this outermost part is helix, okay, and this is lobule of the auricle. And the another impression, this is anti-helix, okay. So this is helix, this is anti-helix, and anti-helix terminate into antitragus, while this part, which is called tragus. So this is tragus and this is antitragus. You can see this is the depression in the auricle, which is called concha of the auricle, and it continue as the external acoustic meatus. Okay, so this is about the auricle. Now we will look into blood supply and nerve supply of the auricle. So auricle, the blood supply of the auricle comes from three arteries. So three arteries supply the auricle. So the first artery comes from this superficial temporal artery, okay, and the superficial temporal artery, wait, superficial temporal artery, which give branches to the auricle, which is interior auricular artery. Then posterior auricular artery and the occipital artery from the external carotid artery also give blood supply to the auricle. The nerve supply of the auricle is, the auricle has outer surface or outer part, lateral part, and the medial part, which is inner part, okay. So the outer lateral part is supplied by the three nerves: auriculotemporal nerve, okay. So this is auriculotemporal nerve, which supplies the upper outer part, while the lower outer part is supplied by greater auricular nerve, which comes from the C2 and C3 ventral rami, while the concha part is supplied by the auricular branch of the vagus nerve, okay, while the inner medial part is supplied by two nerves. First is lesser occipital nerve, and the which supply the upper inner part, while the lower inner or medial part is supplied by the great auricular nerve. Lesser occipital nerves come from the C2 cervical spine, while the greater auricular nerves come from C2 and C3. So this is about the arterial supply and the nerve supply of the auricle. Now we will talk about the external auditory meatus. So this is external auditory meatus, and it is 2.5 centimeter long, and it is S shape, okay. So it is not straight, it is S shape. So in order to look into tympanic membrane, the examiner have to make it straight by pulling it upward and backward and lateral, okay, UBL. So this is maneuver for the examination of the tympanic membrane in order to straighten this external auditory meatus, because naturally it is S shape tube, okay. So in order to straighten it, we have to follow this maneuver. We have to pull it up, back, and lateral, okay. So this is about the external auditory meatus, and it is consists of the outer cartilaginous part and the inner bony part, okay. So the bony part is long, it makes 2/3 of the external auditory meatus, while the cartilaginous part is short, and it makes 1/3. The cartilaginous part has a wax gland which secrete the wax. Okay, and the nerve supply comes from the auriculotemporal nerve and the auricular branch of the vagus nerve, while the arterial supply comes from the superficial temporal artery, as we have already seen. So the superficial temporal artery, okay, the posterior auricular artery from the external carotid artery, and deep auricular artery from the maxillary artery. So it's about this tube which is external auditory meatus. Now this membrane which separate the external layer from the middle layer, this is called tympanic membrane, and it has 3 layers. The outer layer is made of skin of the external auditory meatus. The middle layer is fibrous layer, and the innermost layer is made up of mucous membrane from the tympanic cavity or middle ear cavity. Now the tympanic membrane has 2 parts. The upper lower part, small part is pars flaccida, while the larger part is contributed by the pars tensa. Okay, so this is pars tensa, while this one, the smaller part is pars flaccida, and these 2 parts is separated by 2 malar fold, interior malar fold and posterior malar fold, while this depression in the middle of the tympanic membrane is umbo. It is called umbo, the depression in the center of the tympanic membrane, and it is formed by the handle of malleus. Okay, so this is handle of malleus which is attached to the tympanic membrane, and it makes a depression in the center of the tympanic membrane which is called umbo. So the nerve supply of the tympanic membrane is supplied innervated by the outer part of it is innervated by the outer part of the tympanic membrane is innervated by the auriculotemporal nerve and auricular branch of vagus nerve, while the inner surface of the tympanic membrane is supplied by the glossopharyngeal branch of the glossopharyngeal nerve, which is tympanic branch of the glossopharyngeal nerve, while the arterial supply comes from the maxillary artery, and its branches like deep auricular artery and interior tympanic artery. Okay, so this is about the tympanic membrane. Now we will go to the middle ear cavity. So this is middle ear cavity, and it is a box like shape structure cavity which has six walls. Okay, 6 walls. The outer or the lateral wall is bounded by the tympanic membrane. Okay, this is a lateral wall which is formed by the tympanic membrane. The medial wall is formed by the depression or the promontory. So this one is depression or window, which is called round window. Okay, this is a promontory for the cochlea, while above the promontory is the oval window, which is formed by which is bounded by the stapes bone, which is one of the bone of the middle ear cavity. It has also facial canal, and the facial canal, and which contain the horizontal part of the facial nerve. Okay, so in the middle ear cavity there is 2 parts of the facial nerve. One is horizontal part which travels in the facial canal, which is present in the medial wall, while the vertical part is in the posterior wall of the middle ear cavity. Okay, so this is medial wall, while the interior wall is made by 3 structures. Okay, so this tube you can see is eustachian tube. Okay, This is eustachian or auditory tube which connects the middle air cavity with the nasopharynx. Okay, so this is nasopharynx, this is middle air cavity. The tube which connect both of these is eustachian tube or auditory tube, and it is at the interior wall of the middle air cavity. Interior wall also has the muscle which is called tensor tympani. It enters the middle air cavity. So this is tensor tympani. It enters the middle air cavity through its interior wall, and then it attached to the malleus bone. Okay, so it attaches or inserted into the malleus bone. The third structure which is also present in the located on the interior wall is the nerve which is cauda tympani. Okay, so this nerve also pierces are present in the interior wall, while the posterior wall of the middle ear cavity has a muscle which is called stapedius muscle. Okay, so you can see this muscle which is stapedius muscle, and it get inserted on the stapes bone. Okay, so stapes bone, one of the bone of the middle ear cavity. Okay, so this is stapedius muscle which is present in the outer the posterior wall. The other structure which is in the posterior wall is this antrum which is called mastoid antrum. Okay, so the mastoid antrum which mastoid antrum which goes into the mastoid bone which has mastoid air cells. Okay, so this is mastoid antrum in the posterior wall of the middle ear cavity, and it has mastoid antrum, the stapedius muscle, and the canal for the vertical part of the facial nerve, canal for the vertical part of the facial nerve. Okay, so the horizontal part of the facial nerve is located in the facial canal which is located at the medial wall, while the vertical part is located in the facial canal which is at the posterior wall of the middle ear cavity. The roof, now we will talk about the roof of the middle ear cavity. The middle ear cavity roof is made by tegmen tympani. Okay, so tegmen tympani is the bony part which separates the skull from the middle ear cavity, or cranial cavity from the middle ear cavity. The roof, the floor is formed by this bony part which is related to the jugular fossa or an internal jugular vein. So okay, so this is internal jugular vein in the jugular fossa, and it is related to the middle ear cavity, and it makes the floor of the tympanic cavity. So talking about the contents of the middle ear cavity, so the first content is these bones which are called ear ossicles. It has malleus, the middle one is incus, and the terminal part is stapes. Okay, so these are the ossicles, ear ossicles, auditory ossicles: malleus, incus, stapes. Malleus is attached to the tympanic membrane of the which is located lateral at the lateral wall of the middle ear cavity, while the stapes is at bounded the medial wall of the middle ear cavity, and it makes the oval window. Okay, so this is about the content, the first content, while the second content is muscle. It has, the middle ear has two muscle. One enters the middle ear cavity at the interior wall, while the second muscle enters the middle ear through the posterior wall. So this is at the interior wall which is tensor tympani, and it gets attached to the malleus bone, while the second muscle is this stapedius muscle, which enters the middle ear cavity through the posterior wall at the posterior wall, and it get attached to the stapes bone. Okay, so stapedius and tensor tympani. The tensor tympani muscle, which is this one, this is tensor tympani muscle and its tendon. Okay, this is tendon of the tensor tympani and this is muscle. It enters the middle ear cavity on the interior wall, and it gets attached to the malleus bone. This is malleus bone and its handle, which is attached to the tympanic membrane. Okay, and it is innervated by mandibular nerve, while the stapedius muscle, yes, stapedius muscle is this one, which enters to the middle ear cavity on the posterior wall, and it gets attached to the stapes bone. Okay, so these are the contents. Now the nerves which is present in the middle ear cavity is cauda tympani, and the cauda tympani is on the interior wall. Okay, so you can see this is this muscle which is shown in the yellow. This is cauda tympani muscle, which is branch of the facial nerve. The middle ear cavity also has tympanic plexus, which is formed by the tympanic branch of the glossopharyngeal nerve, the facial nerve, and the carotico-tympanic nerve, which is a branch of the sympathetic plexus around the internal carotid artery. Okay, so this is about the middle ear cavity. Now we will discuss the inner ear cavity. Inner ear has two parts, the bony part and the membranous part. The outer bony part and inside the bony part is the membranous part. So it has bony labyrinth. Okay, it has the bony labyrinth, and inside the bony labyrinth it has the membranous labyrinth. So it has outer bony labyrinth and inner membranous labyrinth. Outer bony labyrinth has fluid which is called perilymph. Okay, so it has fluid which is called perilymph, while inside the membranous labyrinth has the fluid which is called endolymph. Now we will discuss parts of the bony labyrinth of the inner ear. So it has three parts. Okay, this circular part, this is called cochlea. Okay, while the second part, this middle part, is vestibule, and this part is called semicircular canals. There are three semicircular canal. This is superior semicircular canal or interior. This one is lateral semicircular canal, and this one is posterior semicircular canals. Okay, so and the middle part is vestibule, while this circular part is cochlea. So this is bony labyrinth, and vestibule has a oval window which is vestibular window, and it is also appreciated at the medial wall of the middle ear cavity. So this is the oval window which is bounded by the foot plate of the stapes. Okay, so this is bony labyrinth, while the medial the inner membranous labyrinth also has three parts. This is cochlear duct. Okay, so this is bony labyrinth which is cochlea, while inside it is the membranous part which is cochlear duct, and it contains organ of Corti which helps in hearing process. Okay, so this is cochlear duct, while the middle part inside the vestibule has the membranous part which has utricle and saccule. Utricle and saccule also has sensory system which is called macula. Sensory macula is present in the saccule and utricle, and it helps in balancing of the body. While the semicircular canal, which is the bony part, it has the membranous part which is called semicircular ducts. Okay, so this is superior or interior semicircular duct, this is lateral semicircular duct, and this one is posterior semicircular ducts. And this membranous semicircular duct has cresta ampullaris, and cresta ampullaris also helps in the balancing of the body. Okay, so this is about the anatomy. One thing that I want to mention, that if there is any inflammation or infection in the middle ear cavity, okay, so the middle ear cavity has 6 walls, and this inflammation in the middle ear cavity is called otitis media, and it can spread into cranial cavity through the tegmen tympani, which forms the roof of the middle ear cavity. It can goes to the jugular fossa or internal jugular vein, which can cause sigmoid cavernous sinus inflammation of the or thrombosis of the sigmoid sinus. Okay, it can goes into the nasopharynx through the eustachian tube, which is at the interior wall. It can spread to the inner ear through the medial wall, causing the labyrinthitis. Okay, so it has many pathway through which it can spread. So this is about the ear anatomy. Okay.